next panel is Becoming Investable, a 360 look at MedTech and HealthTech industries. And we're indeed going to have a 360 look. We have two investors, one serial entrepreneur and CEO, one co-founder, and two industry partners today with us. So please help me to welcome Soyoung Park, general partner at 1004 Venture Partners, Ken Nelson, partner at MedTech Advantage Fund, Annalisa Somera, CEO of Rhaeos, Cristiano Fontana, head of advisory at Lifeblood, Mike Karim, director at Karim Consulting, and Malek Nasr, co-founder at HighLife. And panel will be moderated by Dr. Dylan Attard, CEO of MedTech World. Please welcome them.
So, hello everyone. This is possibly, I guess, one of my favorite panels because it ties very well to what MedTech World does, connecting startups with investors, service providers, and anyone else in between. And I'm generally looking forward to see how we can learn from those who've done it and those who sit on across the different sides of the table. Before we start, I'd love to possibly give each one of you a brief couple of seconds to introduce yourself and how you tie to the panel discussion, essentially.
Thank you for having me, Dylan. Hi, everybody. My name is Soyoung Park. I'm a general partner of 1004 Venture Partners. We have two businesses. One is the investing in transformative technologies to support healthy aging. The other business is 1004 Initiatives. We help non-US companies. When you are ready to come to the US market, we help you to engage with the ecosystem in Silicon Valley and Boston. Great to be here. Thank you.
Thank you.
So I just wanted to start by thanking Dylan and the MedTech World team. I think having it in the city of Dubai, in this area of the country, is very inspiring. When you think about the pace at which this has developed, it's such an incredibly rapid pace. It can only be an inspiration for all of us who are trying to advance patient care. So appreciate everything, Dylan.
Thank you.
So my name is Ken Nelson from Dallas, Texas in the United States. I started out my MedTech career in cardiac rhythm management, first with Guidant, and then with Boston Scientific on the implantable pacemaker defibrillator side. So first 10 years or so of my career was in implantables, then spent the next dozen or so years commercializing what have become 3 of the 4 biggest players in cardiac digital health and remote patient monitoring. The first company called iRhythm that eventually went public. The second was a company called Biotelemetry, which eventually got acquired by Philips. And then the third was a company called Barty Diagnostics, which was eventually acquired by Hillrom. And then more recently, I've started a venture fund called the MedTech Advantage Fund, which is on top of MedTech Innovator. MedTech Innovator is the largest medical device digital health startup accelerator in the world out of Los Angeles. And then involved in a handful of startup boards, as well as the Innovation Advisory Board for both the American Heart Association and Heart Rhythm Society. And happy to be here.
Thank you. Over to you.
First, I also want to share Ken's sentiment. What a great conference, isn't it? Congratulations, Dylan, Yulia, and the rest of the team. So glad to be here. So I'm Annalisa Somera. I'm the CEO of Rhaeos. Rhaeos is a medical device company that's developing this sensor right here. It's a wearable diagnostic. We can detect flow beneath the surface of the skin, so things like blood, lymph, that sort of thing, but we're starting in cerebrospinal fluid. So in terms of my experience, I've been working with early stage companies, primarily medical devices, for about 20 years. I offer the viewpoint from both sides of the table, where I used to work in venture capital, but I also served in senior management roles, leading things like regulatory, finance, clinical, that sort of thing. So I've been at my company for 6 years. I was employee number 1 and have built the company to 20. We are also part of MedTech Innovator that Ken mentioned. We won in 2020, and really glad to be here and share my insights.
Thank you.
Good evening, everybody. I'm Cristiano Fontana. I'm leading the advisory practice at Lifeblood. Lifeblood is a talent acquisition and advisory company out of Houston. Big part of what we do in terms of advisory is helping company becoming venture backable. In terms of my experience, 20 years in MedTech, different functions from commercial and sales. Did my own startup back in 2009 and led it to global deals. I'm also business angels, and I sit on board on different startups across all the different clinical areas.
Hello, everybody. Assalamu alaikum. My name is Mike Karim. I'm out of the UK. I've spent 30 years of my life working in MedTech, taking new technologies to the market around the world. I've worked with companies like Boston Scientific, Heartware, and then other startups. About 10 years ago, I spun a medical device company out of Oxford University, developing a technology to treat brain aneurysms using origami engineering. And I worked through 4 fundraisers and raised over $30 million for that company. I'm a shareholder, but I've stepped away to help other companies be successful, and I run my own consultancy. I'm a venture partner with Synapto Venture Partners out of Singapore as well, and I sit on the board of the Oxford Bio Network. And I'm looking forward to our discussions. Thank you.
Mike and myself are sharing the same microphone here. So hi everyone, my name is Malek Nasr. I am co-founder of HighLife. So HighLife is a company that does cardiovascular devices. Basically, these are mitral valves, so heart prosthesis that we can implant through catheters and without surgeries. I'm based in Paris. The company is based both in Paris and in Irvine, California, and we have operations in Australia, Europe, USA, and of course through a license in China. And looking forward to our conversation.
Thank you. And something that I'd like to share actually as well. Malek is indeed a part-time artist. He actually donated one of his paintings for tonight's auction, which we're going to be doing during our award ceremony, and our proceeds are going to charity. So thank you, Malek, for that.
You're welcome. You'll see me with my painter hat this evening if you're here.
All right, let's dive in. Essentially, this panel does portray the epitome of what MedTech world is looking to do in the region, leveraging our connections from across the world, US, UK, Europe, trying to obviously invite them over, explore different regions, including the Middle East, and share opportunities, challenges, and essentially possibly also invest into the region. So that's something that we're looking to continue facilitating in the next couple of months and hopefully years. All right, so I'm going to start with investors. Obviously, one of the key, essentially, any startup would want to know is from an investor's point of view. Soyoung, what would you look for to be able to want to invest in the startup?
Yeah, thank you for the question. So when generally, when VC was looking for investment, we see majority of the team and also the market. But I just want to talk about my perspectives for the MedTech specifically. When I invest in MedTech, I'm looking for 2 things. One is definitely your scientific value. The other one is your market adoption. My goal is to bring your technology to the world to benefit people, the patients, family, and caregivers. If you have an amazing scientific project, but still is not going to be accepted in the market, for me, that's a red sign. So I like to ensure that you have both of them, scientific value as well as a market adoption strategy.
Do you also look at as you've mentioned, you're going to specifically into MedTech, do you also look at the reimbursement pathways of that startup? And if so, how early do you judge the reimbursement pathway?
Yeah, that's a great question. So when we talk about market adoption, actually it means you are in the health system. Majority of countries, including America, the biggest fund came from the government fund. we can, is a Medicare, Medicaid, as well as insurance, and also all other government program. That's the most majority of health system existing from the tax money. So to get the tax money, as a matter of fact, you need to be in the health system, and I see it as a marketing strategy. Nowadays, I see more DTC, direct-to-consumer products. That's definitely growing up. It's more in the digital health sector. So those are ones I'm kind of more opening nowadays, but I'm basically look for the one, if you can be in the health system, to doctors recommend your product to the patient. Our market is doctors, but end user is patient. If you don't satisfy both areas, I think it's very hard for the MedTech companies.
Great point. So would you have anything to add to that, Kenan? You're a very fun, nice guy, but I think when it comes to sitting on the investor side, you'd make a tough investor.
Yeah, I think, having helped build a couple different startups, I've lived the ups and downs of startups before, a couple of them. And so for me, I feel like you really look for the people that are involved in the startup. You look for that level of passion, you look for that level of perseverance. Because there's so many ups and downs, do they have the passion and the perseverance to survive the really big swings of ups and downs that a startup can have? And so you look at that, you look at the storytelling of the founder. Can they tell the story to build the right culture, a team of people that can take that startup to success? Do they have the storytelling ability to raise funding? And a lot of times it's not raising money once. It could be 3 or 4 or more rounds of funding that they have to raise, and usually increasing amounts of dollars. And that can be a lot of work for many people. It's also about, are they thinking about everything involved in the startup? I think the reimbursement pathway is extremely important. A lot of these companies, they may have a really cool idea, but reimbursement is an afterthought, or they'll start a clinical study and they may design the protocol to get them through CE mark or FDA clearance, but they didn't keep in mind that they also need to get reimbursement for that technology if there's not a code already for that technology. And if they don't keep that in mind when they're designing that protocol, it could cost them a ton of time and money, and they may have to do a completely different study to get the reimbursement code. So there's a lot that we look for, but I think it really starts with the people, and you really look for that level of passion and perseverance, as I mentioned earlier, because it is so hard and there are so many ups and downs.
Understood. And I guess when it comes to people, it's how well they're willing to adapt to the circumstances in front of them. Markets change, industries change, and you'd need flexible teams who are motivated to reach their goals, essentially.
And having gone through MedTech Innovator, and Annalisa's gone through the same program, huge advocate of startup accelerators. MedTech Innovator is the biggest med device digital health startup accelerator in the world. I went through it as Chief Commercial Officer of Barty. I wish I'd known about it at iRhythm and biotelemetry. I would have been able to commercialize them a lot faster. But highly recommend that you look for local programs, maybe go through one more locally, and then as you get a little bit further along, you look at programs like MedTech Innovator and try to get into that. Because they can really help you from trying to figure out the reimbursement pathway, trying to figure out how to design the protocols for the studies. There's just many things they can help you with to scale faster.
Understood. Annalisa, I'm not saying I've put in your name on ChatGPT, but if hypothetically I did, it came up that you were one of the first female that won an MTI grand prize. Is that right?
That's right. First female winner.
When was that?
In 2020.
Wow, that's very good. Because you are a serial entrepreneur, so you've been through this multiple times. And you've obviously raised multiple rounds. What would be your biggest? What were your biggest hurdles in raising finance?
So, I want to start up by saying that I look for money every single day. It doesn't matter if I just closed a round. I'm looking for more money that same day.
Never stop fundraising.
It never stops. Ken, you said, perseverance is something that you look for in people, and I think that's key. I think endurance is absolutely, key. I'm a former marathoner and half Ironman triathlete, and I didn't realize that endurance that I gained in those experiences carried on into my startup, because every day, sometimes it feels like a roller coaster, and it's so hard to raise money, especially in medtech, especially if you're female, especially if you're a minority, and I have all those boxes checked, right? So it's super hard, and I think it's even harder if you're trying to raise money in a condition that not many people don't know about. So I'm targeting hydrocephalus, and I bet there's some people in this room who might not know what that is, but that's okay. It's really hard, but I think persistence is key. Having thick skin is even more keen. I've heard it all from investors. Investors have told me that I've had stars in my eyes, that I was a dreamer, that this isn't going to happen. But I take those experiences, and that's what really fuels me every day to do what I do.
The other thing I love is that Annalisa has her patch in her pocket. I've got 4 different things in my pocket for 4 different companies. If you're commercializing a company, if you're really passionate about a company you're invested in, you should have the products on you, and I love that you have it with you.
Thank you.
Does it get any easier by time as in raising multiple rounds for multiple companies? Was it any easier?
I think it gets easier over time because, as an investor, it asks you the question, you've heard it already, whether in your current company or a previous one. So you have an answer bank, that just gets bigger and bigger over time. So raising money will always be hard, but I think over time it gets easier.
Understood. And Mike, you're essentially, you were previously part of a medical device company. Now you're sitting on the other side of the table. Looking back, what have you learned that you would have wanted to know back then, which would have made your life easier as a medical device executive, much easier?
That's a great question, and I would echo a lot of, actually everything that Annalisa has mentioned. I think when I look back, one of the really important things when looking for funding is to really try and put yourself in the investor's shoes. So try and understand where they are in their cycle. Try and understand what type of funds they have available and what their sweet spots are. So I think one of the things I did early on was, just go out and look for lots of investors, but you've got to try and differentiate between the different types of investors. So I would advise people to really do their homework before going out and talking. So do the desk work, talk to people, understand what type of technologies investors are looking for, attend great conferences like this, where you will learn and build your network and talk to people who've worked with those different investors. Persistence and having a thick skin, I really think is important, because you're going to get 100 no's before you get a yes. The really important thing about the no's that you will get is you can learn from every single one of those no's. So whether that's a difficult question that's come up that will put you in a better position next time you talk to another investor, or if it's understanding more about the cycle of the investors and actually what they are looking for. So I'm a great believer in learning through adversity, and physical training or other types of training in sports or music or whatever it is. Anything that's really challenging to overcome will help you to develop that mental muscle and that capacity to be able to overcome challenges with investors. And one little piece of advice, whenever you get a no from an investor, is ask them who else they could introduce you. They've got great networks. The chances are they'll know somebody else who may well be interested in your technology. And whenever I've asked that question, I've never had anybody say, no, I won't introduce you. And usually they'll introduce you to 5 other people. And that builds your network.
One of the quotes I get by with, actually, is your biggest yes is 1,000 no's away. And I think even from a MedTech world's perspective, I don't think I would have been here if I didn't count on that after 100 or 1,000 no. So you're very right.
The other thing is no doesn't necessarily mean no. A lot of times it means not yet. So keep coming back when you have those additional milestones. Keep educating them as you continue to progress. And for the salespeople in the room, I mean, our jobs start at no. You have to keep pushing and selling them and telling a better story as to why they should be interested in investing.
Understood. Malek, I'd love to hear your take on possibly any hurdles you've overcame, especially yourself being in Europe. Because most of the time, especially when it comes to the MedTech industry, the US is the mecca of MedTech, I would say. How easy or how difficult was it for you to raise your company? I mean, if you don't want to say, whoever wants, I guess.
Yeah, okay, I'll take it and then...
Yes, please.
Yeah, so, well, I think you have to be prepared for the unexpected. And, you know, if we go back a number of years, who would have expected all the unexpected things that have happened? So we raised our seed funding. That took a good year and a half. And that was on the basis of the medical device directive in Europe, where you go for CE mark, get that with fairly small numbers of patients, and then build some traction in the market and then go for FDA. But within, I think it was 2 years of raising, we had to pivot and change our business plan because the MDR came in and suddenly blew that away. And we were then looking at a situation where we had to go down an FDA route, which gave more certainty to investors. You know, we could map that out versus the opaqueness of MDR, but it also meant we had to then go out and raise more money. So that was a big challenge. Actually, before that came Brexit, which everybody knows about, and I'm not going to mention the B word too much, but that presented a challenge with currency exchange and making it more challenged to hire people because of loss of freedom of movement within Europe. So again, we had to overcome that and find other ways of working. And then, of course, the other one that affected everybody in this room, which was COVID. So again, we worked around that. Our team, our engineering team, had predicted there would be lockdowns in the UK. They actually came to me and said, Mike, we suspect what's going to happen. We've already set up labs in our own kitchens at home. And I said, wow, that's really impressive. I hope you've okayed that with your partners as well, which they had done. But that really helps us through. So I think building a great team and empowering them to take informative decisions and be brave is a way that your company will be able to overcome challenges and hurdles. But yeah.
Was it any easier for you in Paris, Malek?
Maybe just one comment on this. When we're talking about financing in Europe, you have different, I would say it depends on the stage where your company is. So early financing is actually not super difficult in Europe because there's a lot of help, there's a lot of, I would say government money that goes into it. And then when you need larger sums, this is where you need to turn to US funds, etc. In our case, having also an office in Irvine, California, and actually manufacturing in California, actually, we can present ourselves as both, and that's what we are, both a European and an American company. So it was equally, I would say, easy to have access to both funds or either on both sides of the Atlantic. So that was actually helpful. But maybe one thing I wanted to mention, Dylan, regarding the difficulties with the investment is when you're working on a very innovative device, you're not only creating the technology, you're also kind of creating the market with it. So, and I'm sure, Annalisa, you know what I'm talking. Like, you need to convince that there is a market if you're the first to the market. And this is where there are ways to do it, of course, and we can show that by analogy how other devices have created new markets and expanded. But this is where the convincing work, or some of the convincing work, was for us with the investors. Really something innovative, unknown. How do you make sure that they see the potential for it? Yeah.
Being an artist, actually, being so creative and coming up, does it help you to make to look at things differently? As I'm generally curious, actually.
Yeah, I mean, so I'm an engineer by training, biomechanical engineer, and I think, I don't believe in the fact that when you're at work or when you're at your house or in your daily life, you're two different people. I don't think you leave your personality at the door and then you're going to the office. So, and I see, Ken, it seems like you're nodding. So you're either, I think we're all creative if you want to, and you either believe in that and you say, I'm creative in my work and I can invent devices, but I can also have a creative approach in other things, which are related to how you express yourself. I think this is these are not separate domains. This is just how your brain functions. And depending what you're looking at, your brain is going to function the same way. So I don't think we are made of silos, I would say.
Agreed. Cristiano, you're essentially now leading advisory at Lifeblood, sitting right in between, I would say, between you'd need to work with investors and startups. What advice, given that you essentially working with both without taking any sides, what advice do you have to share to startups?
Well, we support a lot of companies through the struggle that I heard, and I agreed with everything that has been said so far. We don't provide the technology, right? We don't provide the perseverance that you were talking about. What we provide is trying to support the companies to have the consistency along all the items that are important in order to be compelling to our investors. So we help understanding a little bit what, Mike, you were saying about understanding who is in front of you, so understanding the metrics of the investors, because you have to be compelling and convince them that you're going to get their money back with the kind of return that they're expecting. And they have really strict investment thesis, especially when we're talking about institutional. And also another thing that I heard, probably Ken, you said, many times you pitch to investor and you hear that it's a great technology, they like the team, but you just have to wait and push it to the next milestone. So it's also important understanding, and we help that understanding if the phase is correct for the right type of investor. Main investor that they expect to see clinical data, and a lot of time you waste a lot of time, but pitching to the wrong investors. So that's being an investor, being an advisor, being an entrepreneur. That is how we try to support our clients through this kind of struggle that they having.
And I'd assume you're working with a good number of startups who have just successfully raised a fund and are now looking to hire your services to eventually take them on to the next round. Are there any common mistakes that startups make that eventually makes them non-investable in their next round?
Well, a lot. I would say most of the problem happens after raising. You cannot waste money when you don't have money, right? When you get funded, then it's time to deliver what you said, and most likely you have to really speed up and grow your team, and you have multiple activities that are run in parallel. So that's where all the issues starting to happen, and maybe you don't, maybe you have some clinical studies that turn out not to be as good as expected, or something happened or the market change, anything that can happen that could jeopardize your story. But at the end, I think investors are quite expert, and they know that along the journey of a startup, things happen, and they also look at the team, how they have been reacting and pivoting, and how quickly they've done it. So yes, you can have problems, but problems are expected, I would say, and it's a matter of how you basically pivot and find a way to figure it out.
Very good points. I've only been doing this for the past couple of years, I would say. Sometimes I'm seeing startups doing their best to close their round. They manage to close it, and then eventually, as soon as they start working with their investors, it turns into a near toxic relationship sometimes. And I'd love to ask you an open question for all the panel, actually. How easy, how difficult was it to manage some of your investor startup relationships, both from an investor side as well as from a MedTech startup side, and possibly some tips founders and startups as well as investors should avoid when dealing with both sides? Maybe you'd start, Soyoung.
Yes. So one portfolio management is one of our most important job. Mainly, once we enter the deal, we want the company to be successful. How we can be successful? You can improve your pipeline. You expand your market pipeline. And also, as a matter of fact, as an investor, we're looking for what would be your exit strategy. I say 1004 Venture Partner is very specialized on that exit side. We have expertise and experience to help companies to go to exit. More than anything, I know a lot of early phase startup founders think, oh, that's too far away. I'm very busy to build what I have right now. But that's not really the way we actually be successful. Being successful means you achieve it, bring to the market, and then you actually exit this company. A lot of early phase startups has attachment. This is my baby. I don't want to leave it. I want to keep it as long as I can. That case, as an investor, that's a really, really concerning, because once you are mature, you should be able to let it go. You need to help company grow, not yourself to grow. So that's the one thing we really want to ensure, that early stage founders are ready to, when you be able to step down and when you can actually engage the people who can make the company grow for the future. And also engage with the future, your buyers for the M&A, or possibility go to IPO. If it's possible, always think about how you can actually bring our company to the market, and then public financial market as well. IPO is a separate story. It's not just you put in the Wall Street and then you just go to the IPO. Investment bankers actually work a lot to ask to future buyer, future investor, institutional investors, if you want to enter IPO. Those kind of things, of course, we financial people working on, but still, as a founder, I want you to think about what kind of people are interested to buy my company in the future, who wants to help us to grow further beyond the startup stage.
Would you have anything to add? Any insight to my question?
I think when you're looking at either investors or board members, it's kind of the same thing. You're looking for partners to help you through the good times and the bad. So as best as you can, you want to try to flush that out. Not all money that you can raise is going to be helpful money. Sometimes you raise money from investors who are more of a problem than helpful. So as best you can, you want to find someone who's going to be a partner in the ups and downs of growing that company, and that will also invest all the way through. You don't want someone who's going to invest, and then as you go to raise Series B or C, they don't continue to invest in what you're doing. So it's finding that right partner. Same with board members. You don't want to put somebody on the board who's not going to really help you out. So you have to be really careful with who you pick. So I think if you think about one of the most important things, in my opinion, that you can do, it's all about focusing on the right people, putting the right people in the right places on your team, finding the right people for the board, finding the right people to be investors in the company.
Essentially, what we're saying is, obviously, be wise, take your time to take any decisions, and not just focus on money, because at the end of the day, the cash itself might be the company's killer.
Yeah, I mean, just because someone's going to write you a check doesn't mean you should take it. I know sometimes it's difficult. You may have been spending 6 months or a year, or maybe longer, trying to raise that money, and when someone finally says they'll write a check, your instincts are to take it, but you shouldn't always take the money. I mean, I'd love to hear other people's take on that.
Actually, time is running out, and what I'd love to finish with is maybe each one of you, very short piece of advice, which you would have said to yourselves when you were raising money. Maybe we can start over with Malek over there and work our way over here.
Maybe just one thing I wanted to mention is that for me, from the founder approach, I would say one of the most important things is building trust with your investors. And this goes, amongst other things, through being transparent, meaning don't outrageously oversell things. Of course, you always oversell a little bit, but be trustworthy, and this is where it starts. This is what I would say.
Thank you.
So very early on in my career in sales, I had some really good advice. It was from a guy from Liverpool who was training me, and he said, "Hey, Mike, you know, what you need is a hide of a rhinoceros," which goes back to what Annalisa was saying. So developing resilience is so important. And the other thing is try and enjoy the journey, because it's tough, but the more you can try and enjoy it and live for the moment, and I know you're a great believer in this, we were talking about it before, you will learn and be open to continually learning and seek out good mentors. You know, events like this are great for you to connect, but find people with skills that maybe you don't have that you can learn from. So, you know, build your relationships, make good friends, and enjoy the journey.
I have it. Well, piggybacking on what Malek said about being transparent, I would say the other piece is also look for clarity. So look for clarity and alignment with your investors, because now you're trying to sell them your project, but tomorrow they're going to sit next to you. And if you have not been looking for clarity, then is where friction may happen in future.
To add on to what Mike was saying, you have to really enjoy the journey. You know, through the ups and the downs, when I was raising my seed round in 2020, I had a baby crawling around the floor while I was pitching to investors. And my first VC said no to me twice, right? So that was really, really hard during a very difficult time. But I just, you know, kept going. And I think what motivated me was just really the patience. So I think my advice in the fundraising journey is to remember your why you're doing it, why you're doing it for yourself, and the patience you're doing it for.
Yeah, I think why is so important to the story you tell, not only to investors, but also to the team that you're building. So just to add to what Annalisa said, I'd say be passionate and focus on people and culture.
And my final advice is please remember your vision, what kind of magnitude of impact you bring to the society. And finally, please be hopelessly optimistic. Bring your optimism to your team, so your team have a motivated by you.
Thank you. I think we did manage to make some very good points. I do appreciate your genuinity and even the tone of how passionate you spoke about from where you came from, be it if you're now sitting on the investor side. So I do appreciate that. To summarize, I would say I'll go back again to my quote, actually. It's not mine. God knows where I borrowed it from. But anyways, your biggest yes is 100 or 1,000 no's away. And I think if you stick to that, having the hide of a rhinoceros or an thick skin, no one can bring you down. And I think especially in current waters, in the MedTech industry or any other industry, these are really words to live by. So thank you, everyone.